The urgent truth about heart attacks. I've worked in emergency rooms for over 30 years, and I need you to hear me clearly. Most people over 60 will not survive their first heart attack if they're alone. That's not fear-mongering, that's fact. Almost half of heart attack deaths happen before the patient ever makes it to the hospital. Why? Because they waste time. They hesitate. They panic. They don't know the simple life-saving actions that can keep blood flowing long enough for help to arrive. And the brutal truth is this. If you don't know these steps, you could be gone in minutes. Every single day I've seen patients carried into my ER who could have lived if they had just done one or two things differently at home. A crushing pain in the chest, sudden breathlessness, dizziness, cold sweat. And by the time they arrive, the golden window has slammed shut. But here's the good news. There are science-backed techniques, simple actions you can perform right now. Even if you're completely alone, that can double your odds of survival. Not gimmicks, not myths. Real strategies cardiologists teach their patients. In this video, I'll walk you through 7 life-saving tips every senior must know to survive a heart attack when nobody else is around. These are the very steps I wish every patient in my ER had practiced before their attack. And wait until you hear number 3. It's so powerful. Research shows it can make the difference between permanent damage and walking out of the hospital alive. Most people have no idea, but after today, you will. All medical references and scientific studies I mention are listed in the description below. Before we dive in, here's a quick question. How old are you? Tell me in the comments. I personally go through and reply to every single one like it's a conversation in my clinic. So don't hold back. Now, without any further ado, let's start with number 7 on our list. And it's the very first step that could decide if you make it out alive. Tip number 7. Call emergency services immediately. Number 7. Call emergency services immediately. Don't wait it out. The very first and most critical action when you feel the signs of a heart attack is this. Call emergency services immediately. Do not wait. Do not second guess. Do not tell yourself, maybe it's just indigestion, or I'll see if it passes. Every minute you wait, the damage to your heart muscle grows worse. Cardiologists explain it in simple terms. Time is muscle. The longer blood flow is blocked, the more heart cells die and the less chance you have of walking out of the hospital alive. Research backs this up. According to the American Heart Association, patients who call emergency services within the first 5 to 10 minutes of symptoms have survival odds up to 50% higher compared to those who delay. Yet, tragically, many seniors downplay their symptoms. Studies show nearly 1/3 of people over 60 wait more than 2 hours before seeking help, often because they don't want to bother anyone or believe they can tough it out. That hesitation can be fatal. Picture this. A 68-year-old grandfather in Ohio felt a strange pressure in his chest one evening. He told himself it was probably gas, drank some water, and sat down to rest. He waited for hours, hoping it would fade. By the time his daughter found him and called 911, the damage was irreversible. Doctors told the family that if he had called emergency services right away, he might have survived with minimal heart damage. That story repeats thousands of times every year, and it's preventable. So, if you're over 60 and you ever feel crushing chest pressure, sudden shortness of breath, unexplained nausea, or that eerie cold sweat, act as if it is a heart attack until proven otherwise. Pick up the phone and dial emergency services without hesitation. Even if it turns out to be indigestion, you've lost nothing. But if it is a heart attack, and often it is, you've just taken the single most important step to save your life. Recognizing the urgency and making that call is the first act of survival. But while you're waiting for paramedics to arrive, what you do next can keep your blood moving and buy you even more precious minutes. Tip number 6. Chew an aspirin if available. That leads us to tip number 6, a technique proven to keep oxygen flowing when every second counts. Number 6. Chew an aspirin if available and not allergic. Once you've called emergency services, the next move can be the difference between life and death. Chew an aspirin, not swallow, chew. Why? Because aspirin is not just a pain reliever. It is one of the most powerful clot-fighting drugs you can get without a prescription. Heart attacks happen when a clot blocks blood flow to the heart muscle. Aspirin works by thinning the blood and stopping the clot from growing larger, keeping some flow moving until help arrives. The science is clear. A landmark study published in The Lancet found that taking aspirin during a heart attack reduced the risk of death by 23% in patients. But here's the catch: speed matters. The faster it gets into your bloodstream, the faster it starts working. Swallowing an aspirin whole can take 10 to 12 minutes to break down in your stomach. Chewing it breaks it apart instantly, allowing the active ingredient to absorb through your mouth and stomach lining within just minutes. In a situation where every second counts, those minutes can save heart muscle and save your life. One retired bus driver, 70 years old, was alone in his living room when he felt that crushing pressure in his chest. He remembered his doctor's advice, reached for the aspirin in his cabinet, and chewed it while calling 911. Paramedics later told him that simple action kept his blood flowing just enough to prevent major heart damage. He walked out of the hospital 2 weeks later, alive and still independent. But here's where many seniors go wrong. They either don't keep aspirin in the house or they hesitate because they're not sure if it's safe. If you have an allergy to aspirin, a bleeding disorder, or if your doctor has specifically told you not to take it, then skip this step. For everyone else, keeping a bottle of uncoated aspirin in an easy-to-reach place is one of the smartest emergency precautions you can take. Doctors usually recommend one full 325 milligrams tablet, chewed at the first sign of a heart attack. Think of it this way. Chewing that one pill is like sending in a rescue team to slow down the disaster until reinforcements arrive. It doesn't cure the heart attack, but it can stop the damage from spiraling out of control. Acting fast with aspirin keeps the odds in your favor. But surviving a heart attack alone isn't just about what you take. It's also about how you move your body in those terrifying minutes. Tip number 5, loosen tight clothing and sit upright. And that's where tip number 5 becomes crucial. Number 5, loosen tight clothing and sit upright. It helps reduce strain on the heart. When a heart attack strikes, every movement you make affects how much strain your heart must endure. One of the simplest yet most overlooked survival actions is to loosen tight clothing and sit upright. Seniors often underestimate how quickly restricted circulation and poor posture can make a bad situation worse. Tight belts, waistbands, or collars compress blood vessels and make it harder for your body to circulate oxygen-rich blood when it needs it most. Sitting upright relieves pressure on the diaphragm and lungs, making breathing easier and reducing the workload on your already struggling heart. This isn't just common sense, it's backed by physiology. During a heart attack, your heart is desperate to pump oxygen through narrowed or blocked arteries. Lying flat forces the heart to work harder, especially in seniors with weaker lungs or pre-existing conditions like COPD. By sitting upright, preferably at a slight angle with your back supported, you improve airflow into the lungs, lower pressure inside the chest, and allow blood to flow more effectively. A clinical review in the European Heart Journal emphasized that positioning patients upright during cardiac distress helps reduce pulmonary congestion. Basically, the buildup of fluid in the lungs that makes breathing feel like suffocation. In other words, the way you position yourself can literally mean the difference between gasping for air and keeping calm enough to survive until help arrives. One 74-year-old woman in Florida felt chest pressure while gardening. Instead of lying down in panic, she moved to a chair, loosened her gardening apron and waistband, and sat upright while waiting for the ambulance. Her doctor later told her that decision likely prevented her from fainting and collapsing before paramedics could give her oxygen. That tiny adjustment kept her heart from collapsing under the strain. It's a step so simple that many seniors overlook it, but it matters. If you feel those telltale signs, pressure, shortness of breath, or cold sweat, sit upright, relax your shoulders, and free your chest and waist from restriction. Think of it as giving your heart room to breathe. This adjustment buys you precious stability. Tip number 4, cough strongly if you feel faint. Now, let's talk about tip number 4, cough strongly if you feel faint. This one sounds strange, but it's a technique that can actually keep you conscious long enough for help to arrive. When a heart attack disrupts blood flow, your blood pressure can plummet. That sudden drop can make you feel lightheaded or cause you to pass out. But coughing, a deep, forceful, rhythmic cough, can temporarily raise blood pressure and keep oxygen moving to the brain and heart. This technique, sometimes called cough CPR, is controversial, but in specific cases, it can help sustain consciousness for a few critical moments. Doctors have used it in emergency settings to keep patients responsive until defibrillation or advanced care begins. Here's how it works. Take a deep breath, hold it for a moment, and then cough hard, like you're trying to clear something stuck in your throat. Repeat this every 2 seconds until you regain stability or medical help arrives. The pressure generated by the cough momentarily increases circulation and helps the heart continue pumping blood. Now, let's be clear. This is not a cure for a heart attack and should never replace calling emergency services. It's a temporary measure to buy time if you feel like you're slipping into unconsciousness before help arrives. A 62-year-old teacher once shared that she used this technique after feeling sudden chest tightness and dizziness at home. She remembered reading about it in a health magazine, took deep breaths, and coughed hard every few seconds while waiting for the ambulance. When paramedics arrived, she was still conscious. Her heart rhythm had stayed just stable enough for them to begin treatment immediately. The takeaway here is simple. Don't panic. If you feel faint or your vision starts to blur, breathe deep and cough rhythmically. That repeated effort could keep you alert long enough to survive until trained help reaches you. Tip number 3. Stay calm and focused on your breathing. Tip number 3 is the hardest, but also one of the most powerful. Stay calm and focus on your breathing. It might sound impossible in such a terrifying situation, but your body's response to panic can make the attack far worse. When fear sets in, your adrenaline spikes, your heart races, and your blood vessels constrict. Exactly the opposite of what your body needs when oxygen flow is already limited. Staying calm isn't just mental strength, it's a biological advantage. Take slow, deep breaths, in through the nose, out through the mouth. This simple rhythm stabilizes oxygen flow and reduces the workload on your heart. Controlled breathing helps your body use oxygen more efficiently and prevents hyperventilation, which can make dizziness, nausea, and chest pain even worse. One cardiologist described it perfectly. The calmer you stay, the longer your heart has to fight. That's why patients who manage to stay composed during those critical first minutes have significantly better outcomes once they reach medical care. A 75-year-old widow from Arizona experienced this firsthand. She woke up in the night with intense chest pressure and shortness of breath. Instead of panicking, she sat upright, loosened her robe, focused on slow breathing, and calmly called 911. The dispatcher guided her through breathing control until paramedics arrived. Her doctor later said that remaining calm likely prevented cardiac arrest before she reached the hospital. So, remember, panic wastes oxygen. Calm saves it. Focus on your breath. In through the nose, out through the mouth. You're giving your heart the fighting chance it deserves. Tip number 2. Avoid lying down or walking around. That brings us to tip number 2. Avoid lying down or walking around. This is one of the most misunderstood reactions people have during a heart attack. When pain strikes, many instinctively lie down to rest, while others pace around, thinking it might ease the pressure. Both can be deadly mistakes. Lying flat puts strain on the heart and lungs, especially when blood flow is already compromised. It can cause fluid to build up in the lungs and make it harder to breathe. On the other hand, moving around increases the heart's demand for oxygen, something you don't have enough of during an attack. The correct move is to stay seated, stay still, and stay supported. Ideally, sit on a firm chair with your back straight and feet flat on the floor. This posture optimizes circulation while minimizing physical stress. A 69-year-old retired engineer once told doctors that after feeling the first signs of a heart attack, he tried walking it off to see if the pain would subside. Within minutes, he collapsed before his wife could call for help. Doctors said that if he had stayed seated and still, his heart would have had a far better chance to keep pumping until paramedics arrived. So don't try to tough it out or walk it off. Heart attacks are silent thieves of time. Every heartbeat counts. Sit down, breathe slowly, stay calm, and let help come to you. Tip number 1. Keep emergency numbers and medications accessible. Finally, tip number 1. Keep your emergency numbers and medications accessible. Preparation saves lives. Most seniors never think about accessibility until it's too late. In those first few minutes of a heart attack, you won't have the strength to search drawers, climb stairs, or dig through a purse. That's why every senior should have an easy-access emergency kit within arm's reach, especially near your bed, living room, or kitchen, where most heart attacks occur. Your kit should include 3 essential items. A bottle of uncoated aspirin for chewing immediately. A written list of your medications and medical conditions. Emergency phone numbers, paramedics, your doctor, and at least one family member. Keep them visible and easy to grab. If you live alone, consider a medical alert device or smartwatch with an emergency call button. Modern devices can detect abnormal heart rhythms and automatically call for help even if you lose consciousness. Preparation doesn't mean living in fear. It means respecting your life enough to protect it. Just like you keep a fire extinguisher in your kitchen or a spare tire in your car, your emergency kit is your lifeline for the moments you can't control. Final message: you have more power than you think. So let's recap. The 7 life-saving steps to survive a heart attack when you're alone are: call emergency services immediately. Chew an aspirin if available and not allergic. Loosen tight clothing and sit upright. Cough strongly if you feel faint. Stay calm and focus on your breathing. Avoid lying down or walking around. Keep emergency numbers and medications accessible. These steps might seem simple, but together, they can make the difference between tragedy and survival. The truth is, you have far more control in those moments than you think. I've seen countless patients who made it through their first heart attack because they acted fast, stayed calm, and respected those precious first minutes. You can do the same. So please, take a moment right now to prepare your home. Share this knowledge with someone you love, and keep these steps in mind. You may never need them, but if you do, they might just save your life. If this video helped you, give it a thumbs up, share it with others, and subscribe for more life-saving health insights. Stay strong, stay prepared, and stay alive. Thank you so much for watching. Remember, your heart has carried you through every joy, every heartbreak, every moment of your life. It deserves your care and attention. Take a few minutes today to prepare, to learn, and to share this message with someone you love. You never know whose life you might save, maybe even your own. If you found this video helpful, please like, share, and subscribe to stay updated with more simple but powerful health tips that can truly make a difference. Take care of your heart, listen to your body, and never ignore the signs it gives you. Stay safe, stay aware, and I'll see you in the next video.